Hello, and thanks for joining us here on Virginia This Morning. I'm Cheryl Miller.
And hello, I'm Greg McQuaid. MRSA. It's an infection that's caused by a strain of staph bacteria, and you may recall late last week, CBS 6 News learned that a Richmond area hospital had an outbreak in their NICU. It was a serious outbreak where one baby died and 10 others got sick, and it forced the hospital to close the neonatal intensive care units.
Dr. Diane Sinnatamby is here today with us to talk about two types of MRSA infections and what you can do to protect yourself from exposure. Good morning, doctor. Thank you so much for joining us today.
Hi, doctor.
Good morning.
Let's talk more specifically first about what MRSA is. Can you explain it to us?
MRSA is a type of staph infection, just like you said. It's resistant to the regular standard penicillin antibiotics. It's tested against an antibiotic called methicillin, hence the name methicillin-resistant staph aureus, or MRSA.
Who is most at risk, doctor, for MRSA?
Okay, there are two types of MRSA. One is the community-associated MRSA, which you find in the community, and also the hospital-acquired MRSA. The community-acquired MRSA is what I'm going to mainly stress on today, and it could be found in anybody in the community, healthy people. And the way you get it is from coming into contact with someone who has a skin infection, who has MRSA, or even a healthy person who is just colonized with MRSA. Contaminated surfaces like countertops, gym equipment, sharing personal items like razors, towels, or being in crowded settings like in an athletic group, prisons, in the military, where you're bunched up together with other folks.
So even someplace like a crowded workplace could possibly be?
Yes, it is possible.
How do you know if you have the infection?
Usually in the community setting, you would manifest as having a skin infection. It might be a little pimple or boil, or you might think it's an insect bite, but it could very well be MRSA. So if you are concerned about a skin infection, go see your doctor. He can have that wound cultured out, and you would know the results in 48 to 72 hours.
Now, many people have the gym on their list of things to do every single day. They go to work, they work with other people. How do you protect yourself from MRSA?
Yes, that's good you brought this up, because prevention is the most important thing in the control of this infection. Hand washing, soap and water, the most important practice that you can adopt any day. If you don't have soap and water, hand sanitizers, alcohol-based sanitizers, and these days they are freely available. You see them in public places, in gyms, even in the supermarket, in doctors' waiting rooms, hospital lobbies, so just make use of them.
So those kinds of hand antiseptics really work?
They really do work, and I would suggest, wiping down gym equipment before and after use, wiping the shopping cart down. That could very well prevent you from getting an infection.
Now, doctor, if you do contract MRSA, how long does it last, and what is the treatment?
How long does it last depends on how severe the infection is. Community-acquired MRSA is usually a skin infection, and it could be treated with a course of antibiotics that you can take by mouth for 10 to 14 days. And one thing that the patient should remember is, even if you feel you're getting better or the skin infection seems to be getting better, don't stop your antibiotic therapy till you've completed it, because that's how you get the resistance forming in the bacteria.
Let's talk briefly about the hospital type, because some people have to go to the hospital. How do you protect yourself when you are hospitalized from contracting MRSA?
Yes, the hospital-associated MRSA is a significant medical health problem currently, and the way you can prevent yourself in the hospital setting is, again, hand washing. That's the most important thing. Alcohol-based sanitizers. Minimizing your hospital stay. Sometimes that's not possible. Those whose immune systems are compromised due to a medical condition have to be especially careful, and if you're really concerned, you need to wear protective equipment.
Doctor, we have two images right here. What are we going to be looking at here today?
Yes, that's MRSA. That's the staph bacteria that we've been talking about, and that's how it's seen under the microscope under a special stain called the Gram stain.
How about the second image right here? We'll call this up.
That's a skin infection, and it can start off looking just like that, a little pimple or blister, or you might wonder if it was a spider bite. And that's how the community-acquired MRSA would initially start off. And then in a severe infection, it could spread right down your arm or leg and look really red and swollen and feel warm to touch.
Now, from the time you get an infection, how quickly would you develop something like that picture that we saw, more like a boil?
It depends. Some healthy carriers can just carry the bacteria on their skin, on their nose, and not have any infection, whereas others, depending on your immune system, could develop an infection like that in 2 to 3 days.
So some people can be carriers and not be sick from the illness.
That is correct.
Oh, that's kind of scary.
Dr. Sinnatamby, thank you so much for coming in and sharing your information about MRSA.
Thank you for having me.
Protect yourself.
Thank
Thank
you.
you.
Remember